to all of you. This is the second module of cosmetic formulations, and after completing this module you will be able to know about sunscreens, what are the requirement of sunscreen product, different types of sunscreen agent, SPF, what are dental preparation, requirement of dental products, and formulation and evaluation of dental product. So, what is going to be our lesson plan? We will discuss what are sunscreen product, ideal properties of sunscreen product, types of sunscreen agent, SPF, how to calculate sun protection factor and factor affecting SPF, dentifrices, ideal properties, advantages, disadvantages, and formulation and evaluation of dentifrices. So, sunscreen preparation, these are the preparations which helps to protect the skin from the harmful effect of UV rays. So, they are available in the form of cream, lotion and spray under the various brand names. These products are applied to the face, neck and ear prior to going out in the sun. Let us have a look on the ideal properties of sunscreen product. Sunscreen product should absorb or filter out the UV rays in the region of 2900 to 3300 angstrom, should have good absorption and spreadability, should be stable, non-toxic, non-irritating, should be free from any side effect and should have low water solubility as not to dilute the sunscreen or sunscreen lotion with the perspiration. So, this diagram shows the different wavelength range of different class of UV rays, UVC, UVB and UVA. So, you can see the wavelength range given in this diagram. Now, different types of sunscreen agent, organic sunscreen agent and inorganic sunscreen agent. Organic sunscreen agent, they reflect the UV light absorption and blocks the penetration of UV radiation through the epidermis. So, para-amino benzoic acid and para-amino benzoic acid esters, benzophenones, salicylates, cinnamates, butyl methoxy, dibenzoyl methane and anisotriazines. So, these are few examples of organic sunscreen agent. So, they are added as a sun protection agent in few sunscreen formulations. Physical sunscreen agent, most common photostable component of routine sunscreen product, and it protects the skin by reflecting and scattering the ultraviolet rays. So, titanium dioxide and zinc oxide, these are the agents which are used as a physical sunscreen agent. Now, SPF, what is SPF? SPF is sun protection factor. You might have heard of in any advertisement of sunscreen product that SPF 20, SPF 15. So, what is that SPF? That SPF is sun protection factor and it is a ratio of minimum dose of radiation of photoprotected skin to unprotected skin. So, this is how it is calculated and it is determined indoors using xenon lamp as an approximate of spectral quantity of UV radiation. So, an ideal sunscreen product should have SPF value of at least 50. Now, what are the factors affecting the effectiveness of SPF? Difference in the skin type, thickness of the applied sunscreen product, time of the day, altitude, each 100 feet increase add 4% of the intensity of the erythema producing UV radiation, and environment, snow, white surfaces reflect 70 to 90%, and when directly overhead water reflects nearly 100% of UV rays. Lastly, vehicle that determines the skin penetration of sunscreen. So, this organic and inorganic sunscreen agents are specialized ingredient to be added in the formulation of sunscreen product along with the other formulation, and the quantity and the type of the ingredient which is to be added in the formulation depends on the type of protection we need from UV rays. Now, evaluation of sunscreen product. Photo stability and water resistance, these are two important evaluation parameters along with the other general evaluation parameters for cream and lotion. Photo stability, it is important because sunscreen product should itself be stable when it is exposed to sunlight. And water resistance is important because it should not get diluted with the perspiration and reduce the intensity of its effect. And other evaluation parameters which are same that we will see in the cream and lotions. Dentifrices, dental product. So, the oral healthcare product which are used for improving and maintaining the oral hygiene. So, dentifrices, they carry the inert and bioactive substance which helps in maintaining the oral hygiene and provide cosmetic and therapeutic benefit. So, dental care product can be classified as regular cleansing dentifrices and medicated or therapeutic dentifrices. Regular dentifrices used for cleaning and polishing the surface of the teeth for maintaining the good oral health. They inhibit the formation of unpleasant odor and freshen the breath. Medicated dentifrices, these are cleansing preparation basically for preventing the tooth decay, for preventing the formation of cavities and other periodontal diseases. So, these medicated dentifrices have additional medicaments such as bactericidal, bacteriostatic, enzyme inhibiting and acid neutralizing agents as a ingredient. Now, let us have a look on the anatomy of the teeth. So, you can see in the diagram the structure of tooth. It shows the enamel and dentine, pulp, gum and bone and the root, crown, which you can easily see in the diagram that this is the structure of tooth, and structure around the tooth. What are the things around the tooth which forms the complete structure? That is the periodontal ligament. Basically, these are fibers which lead the tooth to the jaw bone and acts as a shock absorber for the tooth, which is subjected to the heavy forces during chewing. And oral mucosa, this is the term used to describe the moist tissues that lines the mouth. Gums, these are soft tissues around the teeth and bone and gives protection to the bone and the root of the teeth. Bone, it provides the socket around the support the root of the teeth, and nerves and blood supply. So, this blood supply is necessary to maintain the vitality of the tooth, and each tooth and periodontal ligament has a nerve supply also, and teeth are sensitive to a wide variety of stimuli. So, this is the overall structure of tooth. Now, we will discuss about toothpaste. Toothpaste, which is a very commonly used dentifrice product in our day to day life. So, most popular, very widely used preparation for cleansing the teeth, and it possesses the largest market share among all the dentifrices. So, they are more expensive than tooth powders, because of its attractive consistency, better coverage of dental setup, easy to take measured quantity on the brush, and there is no spillage or wastage of toothpaste. Along with the other advantages of toothpaste, it delivers active ingredients such as fluoride and xylitol, which helps in preventing the tooth and gum diseases. And recent advances in toothpaste also enable the high efficiency of health delivery. So, some other toothpaste for kids are also available with fluoride and relatively low abrasion value. So, fluorinated toothpaste can cause fluorosis if it is swallowed consistently for a longer period of time, and triclosan, an active ingredient in many of the toothpaste, can combine with the chlorine in tap water to form chloroform, which is a human carcinogen. So, according to the some scientists, it can leave unborn babies brain damaged. So, this is the drawback of using this kind of toothpaste. So, although in several studies whitening toothpaste shows the ability to improve the teeth color, they have side effects. The most significant one is enamel and dentine abrasion, which in turn leads to increase in tooth sensitivity. So, these are few disadvantages of using this kind of toothpaste. Now, what are the ideal characteristics of toothpaste? It should be non-toxic, non-irritant to teeth, gum and buccal mucosa. It should have very fine particle size and should be free from grittiness, must clean, and the dental surface, it should clean the dental surface more effectively without any scratches. Should be easily squeezed out from the tube to spread on the brush without sinking into it, and the consistency should be constant, and it should not dry quickly, and it should not interact with the part of the containers. So, these are some ideal properties of a toothpaste. So, dear learners, so far in this module we have discussed about sunscreen product, what are the ideal requirement of sunscreen product, SPF, and how to calculate SPF, and factor affecting the efficiency of sun protection factor, and different sunscreen agents, what are dentifrices, and what are ideal properties of dentifrices. Now, moving to the formulation of toothpaste. The raw material used for the manufacturing of toothpaste, they are abrasives, binding agent, detergents, humectants, sweetening agent, flavors, preservatives, and few special type of ingredient like coloring agent, bleaching, lubricants, and therapeutic ingredients. Abrasives, abrasive is a kind of ingredient which are added in the formulation of toothpaste, and they also help in removing some stain from the teeth. So, usually the amount of abrasive is about half of total weight of toothpaste. So, what are the commonly used abrasive? Calcium carbonate, tricalcium phosphate, dicalcium phosphate, aluminum phosphate, magnesium trisilicate, etc. These are few examples of abrasive. Detergent, which are used in 1 to 3% concentration, and the cleansing action of detergent is due to their lowering of interfacial tension and production of foam. Thus, it is going to help in wetting and dispersion of powdered material in the paste. Detergent helps in penetration of toothpaste into fine cracks and other places, where assisting in removal of food particles and debris. Synthetic detergents are very widely used surfactants in toothpaste. Sodium lauryl sulphate, it is one of the most commonly used detergent, and other are magnesium lauryl sulphate and diethyl sodium lauryl, sarcosinate, detergent may also lower the abrasion effect of toothpaste. Humectant, which is used in very high percentage, that is 20 to 35%. It retain moisture and prevent drying out of the toothpaste, and thus it imparts the elasticity to the product. They prevent loss of water and subsequent hardening of the paste when it is exposed to air. Less amount of humectant is used in substances with lower specific gravity. So, commonly used humectants are glycerin, sorbitol and polypropylene glycol, and glycerin is very commonly and very widely used humectant in the formulation of toothpaste. Binding agent are used in the toothpaste to control the viscosity and maintain the creamy consistency. They also prevent separation of toothpaste. Hydrochlorics, which are used for this purpose and usually in 1 to 2% concentration, and earlier starch, liquid glucose and simple syrup were used, but nowadays they are replaced by mucilages of Caraya gum, Tragacanth gum and gum arabic. Sweetening agent, which is used in 0.5 to 2% concentration, and it is used to improve the taste of the preparation in the mouth. Saccharin sodium is the most commonly used sweetener, and the exact amount is determined by the quantity and sweetness of other ingredient present in the formulation. Flavoring agents, which are very essential and used in toothpaste for fragrance and for a good feel after its use. So, flavors are blending of volatile oils, so which produces a pleasant and refreshing smell in the mouth after use. Peppermint oil and clove oil, cassia oil, cinnamon oil, menthol, these are few ingredients which are used as a flavoring agent. Preservative, they are essential, added in the toothpaste to prevent the microbial growth due to the presence of gum and water. Sweetening agent like glycerin and flavors may be added to antimicrobial action of the preservatives, and commonly used preservative in toothpaste are methyl para hydroxybenzoate and propyl para hydroxybenzoate. So, these are two types of preservatives which are used in the formulation. Solvent, most commonly used solvent, and that is water, which is used in concentration of 20 to 40%. So, there are few specialized ingredient in the toothpaste to impart the anti-cavity effect. So, they are called as anti-cavity agents. They prevents the formation of cavity, for example, sodium monofluorophosphate and sodium fluoride and organoamide fluoride and stannous fluoride. So, these are few ingredients which are added in the formulation to impart the anti-cavity effect. Anti-tartar toothpaste. So, these are some specialized type of ingredient which are added in the toothpaste to prevent the formation of tartar. What is tartar? It is basically the dental plaque which leads to the formation of tartar. This is a yellow or brown colored deposit when plaque hardens on your teeth. So, some tetrasodium pyrophosphate and tetra potassium pyrophosphate and sodium dihydrogen pyrophosphate. So, these are few ingredients which are used and to impart the anti-tartar property in the toothpaste. So, clinical studies have shown that starting from the clean mouth, toothpaste containing 3.3% of pyrophosphate ion can inhibit the growth of tartar by approximately 30% after 3 months of regular use. Let us see an example of formulation of toothpaste. So, calcium carbonate, sodium lauryl sulphate, gum tragacanth, glycerine, saccharine, water, flavor and preservatives, these are added all together to form a toothpaste. And what is the exact procedure for the preparation of toothpaste? This toothpaste can be made in stainless steel mixture or planetary mixture or any other mixture used for making the semi solid preparations. So, what you have to do for the formation? Mix the gum with a suitable quantity of humectant without water, and other colloids like methyl cellulose may be dispersed with cold water, ethyl cellulose should be mixed in warm water. So, and you have to pass the other powdered ingredient through a suitable number of sieve and add it gradually to the above binder mixture with a continuous stirring. Then add the above mixture to the aqueous media and finally add flavor and detergent and stir further to obtain the final product. So, it was about the formulation of toothpaste. So far in this module we have covered sunscreen product, ideal properties of sunscreen product, sunscreen agents and dentifrices. What are dentifrices? Their introduction, advantage, disadvantage, ideal properties of dentifrices, what are the ingredients which are used and special type of ingredients which are added into the toothpaste formulation. Now, moving to the evaluation of dental product. Dental care product are evaluated, especially toothpaste which is evaluated for abrasiveness. This is first evaluation parameter which is done by visual observation, and this abrasiveness can be tested by rubbing the toothpaste or tooth powder on extracted dental set and then observing the abrasive function visually or mechanically. This is the way of performing the abrasiveness test. Second is particle size. So, how to determine the particle size of toothpaste? It is determined by microscopically or by sieving. The particle size should be ideal in order to provide a good abrasiveness without any gritty feel and to minimize the damage to the gums. Volatile matter and moisture, a predetermined quantity of product is taken in a dish and it is dried till a constant weight is obtained. So, the change in the weight will indicate the percentage of moisture and volatile matter. Limit test for heavy metal. The dental products are also tested for the presence of arsenic and lead. So, these are very toxic metals and it can harm the user if it is found in excess quantity. So, it must be tested. So, limit test for heavy metal is performed as one of the evaluation parameter in toothpaste. Consistency, the viscosity of the paste and rheology of the powder should be optimum to ensure the smooth flow of product from the container. So, for that viscosity of the toothpaste is measured by using viscometers. Cleansing action, this can be assessed by brushing the teeth for 2 weeks with the toothpaste or tooth powder and then examining the appearance of the teeth before and after by comparing their photographs. So, this is the method how you are going to perform the test on cleansing action. pH of the product, 10% dispersion of the product is made in water and the pH is determined. So, it should be optimum so as not to damage the teeth and gum. Next is foaming property. This test is essential for evaluation of foam producing dentifrices. So, what you have to do, a fixed amount of product is mixed in the sufficient quantity of water and it is stirred vigorously. The foam which is generated is then observed for its nature, density, stability and washability. So, this is how we are going to perform the foam property test in toothpaste. So, dear learners, in this module we have covered sunscreen preparation, ideal properties, sunscreen agents, dentifrices, formulation and evaluation of dentifrices, and we have covered toothpaste in detail in this formulation. So, dear learners, please go through from the suggested further reading and do take part in our discussion forum if you have any query regarding the content of this module.